What is manual handling? Manual handling means transporting or supporting a load by hand or bodily force. It includes lifting, putting down, pushing, pulling, carrying or moving loads. So I'm going to give you a few examples. The first one is lifting a box. Next we have stacking shelves, moving a patient, working on site, farming, working in the office, using a pallet truck, using a dolly, and finally shopping. As you can see, we use manual handling activities all the time. Why is manual handling important? Manual handling gives employees the skills to safely undertake manual handling tasks, reducing their risk of injury. That is because manual handling causes over a third of all workplace injuries. We're going to get into that further on this video. So now we're going to look at manual handling legislation, my favourite part of manual handling. Try not to fall asleep. So what legislation governs manual handling in Ireland? Regulation number 68 of the Safety, Health and Welfare at Work, General Applications, Regulation 2007, Chapter 4 of Part 2, outline the requirements that must be adhered to in relation to manual handling. How often should manual handling training be completed? Manual handling training should be completed once every 3 years. What are musculoskeletal disorders? MSD for short. MSD injuries are soft tissue injuries caused by sudden or sustained exposure to repetitive motion, force, vibration and awkward positions. These disorders can affect the muscles, nerves, joints and cartilage in your upper and lower limbs, neck and back. Here are some examples. The first example we have is ligament damage. The next example we have is sore muscles. And finally, we have a torn muscle. So now we're looking at the importance of the correct footwear. When you come to manual handling, a lot of people don't consider their shoes, how important they are for manual handling. Like what we have here is an example of a good sole and we have a bad sole. You have to understand your soles of your shoes are like your car tires. They provide you with grip. So we have a number of different types of feet. Some people say 9. Here is an example of the 5 basic ones. Okay? It's just knowing what foot you have so you can buy the correct shoe. So now we're looking at your feet arch, and we've got 3 different types. We've got a neutral arch, we've got a mid arch, and we've got a flat arch. What you're looking at here is a neutral arch, and the correct shoe for a neutral arch is always a cushioned shoe. So what we're looking at here is a mid arch, and the correct shoe for a mid arch is always a stability shoe. And finally, we have a flat arch, as you can see in the picture. The correct shoe for a flat arch is always a motion controlled shoe. So now we're going to take a look at the spine. When we're born, we have 33 vertebrae, and as we grow older, the vertebrae fuse in together, and then we have 24. The function of the spine is structure and support. So what you're looking at here is your disc, and it's in between your vertebrae. The function of the disc is to act as a shock absorber. So now we're looking at the inner core of the disc. We have the annual fibrosis. Its job is to contain and protect the soft material located in the center of the disc, which is called the nucleus pulposus, which plays a major role in providing the spine with shock absorption during movement. So what we have here is the human head. The average human head weighs about 5 kgs, which is 11 pounds. So that's more or less heavier than the average baby. And if you want to look at water, for example, it's the equivalent of about 5 litres of water. I was talking to a physio and she has seen a huge increase in the number of neck injuries, and here is why. It's because of your phone, and I am personally guilty of this also myself. And we're all addicted to the phone, let's be honest. If I was to take your phone right now for 24 hours, what level of anxiety would you be? My guessing is you'd probably be a 10. So we are now on our phones all the time and putting stress on our neck. The head is balanced on just 7 vertebrae in your neck and supported by about 20 muscles, which are responsible for moving the head around and keeping it in place. What is manual handling ergonomics? Ergonomics is the practice of designing tasks, equipment for the workplace to enhance comfort, safety and efficiency. Ergonomic principles play a major role in designing safe and effective manual handling practices. Here are some examples of bad ergonomics. So the first example we have is lifting a box incorrectly. Next we have overstretching, pushing incorrectly. Next we have pulling incorrectly. And finally, standing while we work. So when you're doing a risk assessment for your workplace, step number 1, eliminate the risk. Does the load have to be moved? Is there a better way to move the load? Step number 2, replace the hazard. I'm going to give you a couple of examples. Example number 1 is using a pallet truck. Example number 2 is moving a dolly. Step number 3, engineering. Use powerlifting equipment. Here are some examples. So example number 1 is using a forklift. Example number 2 is using a conveyor belt. And finally, example number 3 is using a robotic arm, but just make sure everybody is trained in the use of the equipment. Step number 4, administrative. Sometimes it's not cost effective. An example would be a robotic arm. Use what is relevant inside your workplace. And finally, step number 5, PPE, personal protective equipment. There are 6 main types. Here are some examples. So the first example we have is a hard hat. The second example we have is steel toe foot protection. The third example we have is ear protection. Number 4 is eye protection. Number 5 is gloves. And finally, number 6, wear masks when appropriate. So now we're going to look at the acronym TILE for manual handling. T stands for task. It includes lifting, pushing, pulling, repetitive activities, and team manual handling lifting. I is for individual, which will differ from one person to the next. L is for load. Is the load shaky, heavy, dangerous? Will the load reduce visibility? E is for environment. Is the floor slippery? Can I see from point A to point B? So now we're going to take a look at the power zone. The power zone is the space between your mid-thigh and mid-chest, where you can lift the most with the least amount of exertion. Using the power zone gives you the best chance of keeping a neutral position when you're manual handling. The weight that can be safely lifted will differ from one person to the next. The closer a load is to your body, the more weight you can safely lift. What are the 3 go-to rules of manual handling? Rule number 1, test the weight of the object you're about to lift. Rule number 2, find a stable position and face the load or the object. And rule number 3, use your legs when lifting. So now I'm going to show you how to lift an object. Step number 1, adopt a wide base, shoulder width apart. Step number 2, instead of leading with your head and shoulders, push your pelvis back and then bend at the knees. Keep your back straight so the force of the lift doesn't transfer to the muscles of your back. And the final step, once you have lifted the object, keep your elbows in and load close to your body. This will give you better stability by keeping your center of gravity close to your feet. So now we're going to take a look at manual handling, pushing and pulling. When you're talking about pushing and pulling, use the largest muscle group to make the task as easy as possible. It is usually better to push than pull. That is because you can use your legs and keep your back straight. So when you're looking at manual handling and standing, standing is a natural human position by itself. It doesn't pose any particular health hazard. However, working in a standing position on a regular basis can cause sore feet, swelling of the legs, general muscle fatigue, low back pain, stiffness to the neck and shoulders. It is recommended to try to shift the weight from your heel to your toes and from one foot to the other. Let your arms hang naturally at your sides and keep your back straight and shoulders pulled backwards. So now we're going to look at tips for cars and vans over long distances. Step number 1, seat height. Your hips should be at a comfortable level, allowing your knees to bend naturally. Step number 2, seat backrest angle. Set the backrest slightly reclined, typically between 100 and 110 degrees. This position can distribute your body weight more evenly and reduce pressure on your lower back. Number 3, lumbar support. Always ensure adequate lumbar support. Step number 4, seat distance. Adjust the seat position so you can comfortably reach the pedals. And finally, number 5, seat cushion comfort. Look for cushions with adequate support. It is also advised to take breaks and stretching over long journeys. So now we're going to look at 5 steps to set up the perfect workstation in your office. So when you're setting up the perfect ergonomic workstation, the first 2 components you're looking for is top alignment and sitting posture. So if you look at the first picture, the sitting posture is incorrect. And then if you go on to the second picture, it's the opposite. You have the top alignment is incorrect. So the next picture I'm going to show you is the perfect ergonomic workstation. So what you're looking at here is the perfect ergonomic manual handling workstation. Step number 1, push your hips as far back as they can go on the chair. Step number 2, adjust the seat height so your feet are flat on the floor. Step number 3, adjust the backrest to about between 100 and 110 degrees to the reclined angle. This will help support your lower lumbar region. Number 4, adjust the armrest so that your shoulders are relaxed. And finally, step number 5, chair stability. Make sure the chair is stable and has a 5-point base for optimal balance and support.